We are in the middle of a plague. 40 million infected people is a plague. We are in the worst shape we have ever been in. Nobody knows what to do next. And we have a president who cares more about the unemployed and pits people against each other, just like these people are doing, than he cares about us. And I say to you, in year 10, as we face a figure of 40 million infected people, the same thing I said to you in 1981 when there were 41 cases. Until we get our acts together, all of us, and fight and make this president listen, we are as good as dead.
This is a series about scandals and controversies that have impacted our trust in science. I'm Shane Bergin. I'm a physicist and a science communicator. In this episode, we explore the history of the AIDS crisis and how community activism has driven HIV healthcare. A great deal of what makes scientists trustworthy is the idea that the work they do is for the common good, that benevolent scientists are working in the best interests of everyone. As well as the scientists, there are the people around them, the people in power who control the money that scientists need to do their work. The companies then that take the work scientists do and turn it into products, like medicines. Some of the time, they don't act in the public good. In the 1980s, at the height of the AIDS crisis, governments sat on their hands. They didn't fund research into cures. They didn't really provide healthcare either, because AIDS was primarily affecting people in the LGBTQ+ community. And that meant the community had to fight. They had to fight for access to medicine and to clinical trials. I spoke to author Sarah Schulman, whose recent book, Let the Record Show, documents the formation of ACT UP, a coalition of activists who responded with action to the AIDS crisis and transformed the world for future generations.
In 1979, I became a journalist in the gay and lesbian and feminist media. And so at the time, the corporate media never mentioned gay people or feminism. And there were huge movements going on that had absolutely no coverage. I mean, it's very hard to find out what activist movements actually did. Getting that information is very, very difficult. And so almost every city in the US had at least one feminist paper and at least one gay paper. And there was a group of journalists nationally who did not get paid. We were out there figuring out what the stories were. And I was one of those people. So I started doing this before Reagan was elected, actually. And I was on the beat, as we say, when AIDS was announced. So I predated AIDS as a journalist.
So, Sarah, we might begin, if it's okay, but you telling us a little bit about the overview of the time between the first observation of AIDS in the United States and how that led to the ACT UP movement.
Well, interestingly, the first question is observation by whom? Because we actually have records from the 60s and 70s of homeless people developing vocabulary to describe symptoms that we now know were symptoms of AIDS. So, for example, people talked about junkie pneumonia because they observed drug addicts dying of a weird pneumonia. Now we know that was PCP. Or they had something called the dwindles, which we now know is wasting syndrome. So I would say the underclass observed it to such an extent that they developed vocabulary. And this is 20 years before science observed the pattern. Now, one of the reasons that it took so long is because we don't have a coherent healthcare system in the United States, right? So only middle class and above have access to healthcare. So it was only when it came into communities that had good healthcare that the pattern started to be observed. And this was 1981. But we now think that AIDS is 100 years old. And we think it came to America in the 40s, actually. So when we say that AIDS started in 1981, we really mean that AIDS was noticed in 1981. And the first public announcement was July 3rd, 1981 in the New York Times. 41 cases of rare cancer found among homosexuals in San Francisco.
Scientists at the National Centers for Disease Control in Atlanta today released the results of a study which shows that the lifestyle of some male homosexuals has triggered an epidemic of a rare form of cancer.
A mystery disease known as the gay plague has become an epidemic unprecedented in the history of American medicine. Topping the list of likely victims are male homosexuals who have many partners and drug users who inject themselves with needles. Medical experts say the disease kills 4 out of every 10 people it strikes and that it threatens to explode in the nation's cities.
Researchers know of 413 people who have contracted the condition in the past year. 1/3 have died and none have been cured. Today, researchers here at the National Centers for Disease Control said they had found several cases where people who had been sex partners both had the condition. The scientists say this probably means they are dealing with some new, deadly, sexually transmitted disease. Researchers are now studying blood and other samples from the victims, trying to learn what is causing the disease. So far, they have had no luck.
It's mysterious, it's deadly, and it's baffling medical science. Once thought to affect only promiscuous homosexual males, AIDS is now spreading in epidemic proportions to other segments of the population.
Federal health officials say as many as 1 million Americans may have been infected with the AIDS virus, and more than 12,000 are expected to develop the deadly disease next year. Now, that would double the number of cases since 1981 nationwide.
In the first few years, I covered some very early issues. I covered pediatric AIDS, which was very significant in New York at the time. Now, no children are born HIV positive in the United States, but then a great many were. And so I covered that. I covered women being excluded from experimental drug trials. And I also covered the closing of the bathhouses, which is kind of an odd assignment since women were not allowed in the bathhouses. But it's an indicator of how chaotic everything was, because journalists were dying, editors were dying. Nobody knew what the stories were. The mainstream press ignored AIDS. The New York Times wouldn't even say the word gay. In 1981, homosexuality was illegal in the United States. The sodomy laws were not overturned until 2003. Even in New York City, there was no housing protection. You could be kicked out of your apartment. You could be fired from your job. You could be denied public accommodation. You could be thrown out of a restaurant or denied a hotel. Familial homophobia was culturally the norm and was virulent. And street violence by the police, but also by straight people, was very common. It was like a form of public entertainment called gay bashing.
Police allegedly harassing gays, and police allegedly failing to protect gays when they are assaulted by anti-gay youths, have led gays to form this street patrol, Community United Against Violence. The group advises gays to carry a police whistle to call for help from other gays.
I was stabbed on my front doorstep coming home on New Year's Eve, and another time was beaten as I stepped out of my office.
Are you convinced that it is definitely because you are gay or look gay?
I know it was. They were screaming faggot as they beat me.
Complaints about gay discrimination and violence, gay bashing is the name for it, have risen dramatically.
People report being victims of gunshot wounds, of knivings, assaults with baseball bats, usually accompanied with statements as to the sexuality of the victim.
What do you mean?
You're queer, you're a faggot.
So this was a very profoundly oppressed minority. At the time, there was a lot of pseudoscience trying to prove the cause of homosexuality. Now we know that sexuality is different in each person and changes over the course of your lifetime. But in 1980, that was not known. And homosexuality was seen as one thing that had a cause.
For so many years, the model that psychology used to really control us was an illness model. And unfortunately, many people really felt the negative effects of that. Because in that model, I mean, there was no such thing as being healthy and being a gay or lesbian person. You could have your self shocked out of with aversive approaches to try to make people be straight. In other words, the methods that still were used, you may not be burned at the stake, but there was still very aversive and coercive and really dangerous ways that people were using to try to convert us from being homosexual to being heterosexual. You could be taken away to a hospital, you could be shown photographs that might be a scene with two gay people being romantic, and then literally receive shock treatment to try to make you want to not have that association. Many people were dragged by the parents or went themselves to get change, because the message was, if you are a gay person, you are sick.
So when the headline says 41 cases of rare cancer found in homosexuals, what they really mean is the biological disease of homosexuality itself is now manifesting, as we all knew it would, in this disfiguring, terrible disease that will kill you. Well, that's why the first name for the disease was gay-related immune deficiency. Now, there's no biomarker for being gay. There's no such thing as gay-related immune deficiency. There's no such thing as gay cancer. Cancer cannot be gay. But this is because of the biological determinism that was so prevalent at the time. So that was the beginning. And in the first 5 or 6 years, 40,000 people died in the United States, and the government did absolutely nothing. And what the pharmaceutical companies basically did was recycle failed cancer drugs that they had patents for. And what they were looking for was one pill that you would take that would make your AIDS go away, because that would be the largest market share for the pharmaceutical company. But AIDS is just an umbrella term like cancer. It's different in each person. So that what they were looking for can't conceptually exist. So just so people understand, AIDS means that your immune system ceases to function. And as it breaks down, it manifests in different ways in different people. But the most common things, which were called opportunistic infections, were like dementia, blindness, skin cancer called Kaposi sarcoma, the inability to manifest nutrition, so people would literally starve to death. And so what people with AIDS wanted was treatments for these opportunistic infections. But those were smaller market shares than this one pill concept. And so pharma was not researching those treatments. What the gay community was doing in those first 5 to 6 years was trying to create some facsimile of social services. Now, because of the role of familial homophobia, which is very historically significant and has been grossly underconsidered in looking at these big historical tropes, there was not the kind of network that people who were parts of families had. And many people came to New York as exiles from small towns in America, from other countries, because their families and towns did not want them. So we had a huge population of people who had no network. And therefore, the first push is to create some kind of network.
What have you been able to do for the community to?
Well, a bunch of us started something called Gay Men's Health Crisis, which has now grown to a group of about 150 volunteers. Oh, we've done everything. We've got absolutely no support from any government agency, from any city agency. We've done it all ourselves. We've raised about $100,000. We've given $50,000 of that away to research. We've put about 15,000 copies of that newsletter I showed you out to the public. It is the single most thorough piece of information that has been put out by anyone on all of AIDS. It has a complete bibliography. It has symptoms. It has a whole complete list of doctors in the New York City area. We're running support groups for patients. We are training doctors how to deal with people who may have life-threatening diseases. We've had to do that ourselves. We have support groups for the patients. We have arranged individual therapy for the patients. We are visiting patients in the hospital. We have a hotline which we train volunteers to man. These are calls from people who are saying, I'm concerned, I've got these kind of symptoms, I don't know what to do. I don't have a doctor who's sympathetic. I don't have a doctor who knows about AIDS.
Somehow I think that the community here is more than nervous.
You try not to think about it. You just know that your best friend has died. You just know that a person you had a love affair with is in Lenox Hill Hospital with PCP, which has an 80% fatality rate, and you have to do that for him, and you have to do it for the people who have died or the people who are coming along, and you have to do it in the face of a city that is not giving us any help in terms of social, the mayor. We have to get the information around. It's very hard. I mean, we're putting out a leaflet. We ourselves, this is something that should be done by Who knows, by the government, by the CDC. We are putting out a leaflet that's going to blanket the whole city, 500,000 copies. We're doing this. We are all volunteers. We have medical people on our board, but basically we are lay people without any help from anyone else, I might say.
A Puerto Rican social worker named Diego Lopez, who died of AIDS, started a program at Gay Men's Health Crisis called the Buddy Program. And people would volunteer. They'd be assigned to a person with AIDS. And you would like hang out with him or maybe help him do his laundry or something like that until he died. So there was that. And then there were groups that like would walk your dog, or there was a group called God's Love We Deliver, which would bring home cooked meals. So that's really what the first few years were about, because it was so chaotic. But it had a political turn, primarily because in 1986, the Supreme Court, in the Bowers v. Hardwick decision, upheld the sodomy law. So in the middle of this mass death experience with all this suffering, the US Supreme Court was like, gay sex should remain illegal. And the rage of people was just incredible. And you see all kinds of angry demonstrations on the streets of New York with no permits, very, very angry. And that, I think, really is what created the political environment that allowed ACT UP to be founded on March 10th of 1987.
This beautiful day started with trouble in Lower Manhattan. More than 100 people were arrested during a protest. Demonstrators were demanding more money in the war against AIDS. They brought rush hour traffic to a standstill.
Thousands of financial center workers leaving subways and hundreds more in cars with nowhere to go caught the performance. Its message was blunt. Spend more for research, treatment, and education on AIDS.
They have been ignoring us all these years, and the only way you get attention from them is to hit them where it hurts.
Then, just after 8, arrests began. Police have been prepared for waves of protesters, and that's exactly what happened. As fast as they could take one group off the streets, another group sat down, and Broadway was blocked for more than an hour.
ACT UP, the AIDS Coalition to Unleash Power, direct action group united in anger over the AIDS crisis.
AIDS has made clear that gay people suffer discrimination.
AIDS has led to increased anti-gay violence. Last night in Greenwich Village, several motorists tried to run through some gay protesters blocking
Many
the street.
people believe gays are sick, get AIDS for Christmas, then die. This is hate mail that's increasingly being sent to gay organizations.
Homosexuals say AIDS victims are being discriminated against, evicted by landlords, and feared by health workers.
And from coast to coast, not since the racial unrest of the 60s has one group of Americans suffered such abuse.
AIDS has also become an issue in political campaigns.
If we permit laws that encourage more homosexuals to settle here, increasing the threat to your health.
All over the country, homosexuals are reporting increased discrimination. Landlords, they say, are turning them away. Some dentists won't treat them. Some ambulance drivers won't stop to pick them up. Police, they say, don't respond to their calls. Newspaper headlines add to the panic.
The ignorance out there is phenomenal, and what is spreading this virus, and it is a virus, and people don't even understand that, media stupidity and lies.
Violence against gays and lesbians has increased threefold since the AIDS epidemic has begun. And the medical establishment and government has not come forward.
There's still no one in charge. 10 years in epidemic, millions of people infected, still no one in charge of AIDS.
One of my favorite interviews is with this woman named Karen Timor. So she was a straight woman who saw an article about ACT UP and she thought, wow, those people look great. Maybe that would be a good place to get some friends. So she came to ACT UP, and one day somebody said, oh, we need somebody to work on insurance because, in America, we don't have health care, right? So there's private insurance, and HIV was a pre-existing condition, and you couldn't get private insurance if you were HIV positive. So she said, oh, that sounds interesting. I'll try that. Anyway, for the next 5 years, she masterminded this huge campaign that was carried on by snail mail. Okay, there's no email, in all 50 states. She built coalitions with Gray Panthers, with people with multiple sclerosis, with all kinds of stuff. And she forced insurance companies to remove HIV as a pre-existing condition, thereby making insurance available to 600,000 people.
Stories of scientific progress rarely include the accounts of people harmed or neglected along the way. It's why it's important and indeed interesting to include community histories in the history of science. It helps us to understand how activism and community action has shaped scientific and healthcare policies.
The pharmaceutical industry turned its back on addressing the issue. Could you tell us a little bit more perhaps about that and how ACT UP may have intervened?
Well, it happened in many different ways. So the first I've already described, this misconceptualization of how to approach the disease. But with the issue with women with AIDS, there's even a more complex history, which is that in the 1960s, there was a drug called thalidomide that was given to pregnant women, and thousands of people had children that were born without limbs. So they sued pharma, and pharma had to pay out huge settlements. After that, they said no more women in experimental trials. So by the time AIDS came around, women could not get into experimental trials. But when there are no treatments, experimental trials are the only treatments. And women with AIDS tended to be poorer, tended to be women of color, and women in general get diagnosed with diseases when they're more advanced than men, because women tolerate pain or whatever too, or they're taking care of other people, no one's taking care of them kind of thing. So women with AIDS were more advanced at point of diagnosis, and yet they couldn't get treatments. So this was also a huge battle against pharma.
Same questions as the one before. Never being asked or told of trials for women or children. I learned of trials in the support group. Seems as though I'm not included. The only medication that's offered is AZT and Bactrim. I've heard about AZT for children and the terrible side effects and not knowing the correct dosage. Why are these the only drugs offered? I'm here to tell you more trials should be available for me and the rest of the poor. We should have one doctor. We need health care for everyone, and housing is right too. We are not invisible.
This is a story about racism. This is a story about sexism. This is a story about greed. And this is war. There are people of color, women, IVDUs, children, Latinos, Latinas, Asians are all dying for AIDS treatment. And the National Institutes of Health are refusing to do their job. The National Institutes of Health must recognize that what they do is health care. Clinical trials are health care, and we want it now.
The whole process of the FDA, the drug testing process, took years. We don't have years. This drug, this disease was taking people in months.
City and I have AIDS, and I'm here today because I don't want to die. I know that there are 80 drugs that haven't been tested yet by the FDA. I want to know why it takes 5 to 10 years in this country to test drugs that you can test.
So ACT UP approached this in many different ways. And one was the Food and Drug Administration did have some experimental drugs that they were looking at, but the regulatory process was so cumbersome that it took many, many years for the drugs to become available. And people with AIDS were dying very quickly, and they didn't have years. So a former playwright in ACT UP, this is so interesting because ACT UP people had no science background, yet they became huge experts on the science bureaucracy. Anyway, this man, Jim Igo, studied the FDA and studied the government bureaucracy, and he designed a program called Parallel Track that would allow the FDA to continue the regulatory process while making experimental drugs available to people who needed them on an expanded access basis. And what's interesting there is that's one of the successes of ACT UP, was that ACT UP became the experts on the issues, and ACT UP designed the solutions. And this is a very important lesson for the present, because the big mistake is to get into an infantilized relationship to power, where you're begging them to solve the problem. Because first of all, they're never going to solve it. And secondly, they don't know how. And third, they don't want to. So you have to create the reasonable, winnable, and doable solution. So Jim sent this to Fauci. Fauci was the guy at the time. He's been in power all these years, and he was ignored. So then, like 3 months later, Fauci was giving a talk in public, and Jim went and confronted him. And eventually, through a lot of efforts, including a huge demonstration that shut down the FDA, where ACT UP actually went there, they did finally adopt that proposal, although Fauci tweaked it a little and changed the name so that he could claim credit for it, whatever. But these drugs did become available to people who needed them. Now, the historical irony is that almost none of these drugs worked, very few of them.
Let's take a moment to reflect on where we are now with HIV treatment and prevention. When HIV emerged, government inaction meant that people had to fight for their lives to get access to medication. And it's important that we always remember those who died because of the lack of any medical intervention. Activism is what made drug treatment happen. It's what made the advancements in HIV treatment possible. Activism as a response to prejudice and indifference is at the heart of this story, and it's still relevant today. We now have treatments that make the levels of the virus in the body so low that they are undetectable, which means people won't get sick and they won't pass on the virus. We also have a drug that can prevent HIV infection. This drug is called PrEP, which stands for Pre-Exposure HIV Prophylaxis. PrEP is a tablet that someone who does not have HIV takes regularly to prevent them from getting HIV. It works by stopping the virus from getting inside their cells and replicating. So it's a really important innovation in HIV prevention. But again, activism has been necessary to ensure people have access to it. I spoke to Will Nutland from PrEPster, an initiative that was founded in 2015 by 4 London-based HIV prevention activists. And they did this in response to the lack of clear and concise educational information about PrEP.
We knew that 3 or 4 years prior to the formation of PrEPster, that PrEP was approved by the US FDA, and there was a whole wealth of evidence around at the time that supported the use of PrEP for HIV prevention. And we were concerned that there was a lack of information available about PrEP, particularly in key groups of people, for example, gay and bisexual men living in places like London and Brighton and Birmingham, Manchester, where there were fairly high rates of HIV incidence that was seeing really no sign of diminishing. And so we wanted to tell people about PrEP. There was a growing body of evidence that supported the use of PrEP. We were coming up against barriers from our public health authorities, from NHS England, about the availability of PrEP. So when we formed PrEPster, it had a kind of our tagline was to educate and to agitate for PrEP access in England and beyond. So one element of my experience, Mark experiences as health promoters through almost all of our lives, we took that kind of that education element, started to talk to people about PrEP, and we decided that we really wanted to kind of start rocking the boat so that we could start agitating for PrEP access, given the huge wealth of evidence that there is and was at the time to support access to PrEP. One of the things that we were really at the forefront of fighting for was when in 2016, NHS England reneged on their own promises to push for the full rollout of PrEP on the NHS in England. And NHS England, or bureaucrats in NHS England, made a U-turn in some of those promises around the spring of 2016. We became aware along with some of our other community-based organisation colleagues, that some of those timelines that we'd expected, where things like community consultation should start, that suddenly that paperwork wasn't emerging within those timelines. And we became very suspicious about what was happening. And a bunch of us went on to Twitter and started asking questions. And it very soon emerged that actually one of the reasons that they were getting cold feet was that some of the legal advice that they were obtaining suggested that because PrEP was seen as preventative medicine, it should be funded through local authorities' public health budgets and not through the NHS. And there was a fear that if the NHS agreed to commission PrEP, then that would open the door for a whole load of other preventative technologies that they felt that they were not responsible, they were not the body responsible to commission. And this really became a great fight for all of community organisations in the UK to get behind. And we were part of a coalition called United for PrEP. And United for PrEP took activism on many fronts, right the way from street demonstrations. Some of us went and invaded the headquarters of NHS England and were on old-fashioned, noisy, whistleblowing activists. But our colleagues at National AIDS Trust also took a different approach, and they took NHS England to court and won that case. And then, of course, their legal team stood up and said that they intended to appeal that decision, meaning we did estimates that probably several thousand HIV infections would be the result of that appeal, that we were not able to see PrEP commissioned quickly and rapidly, and instead there would be more legal processes to delay the rollout of PrEP in England. And that was a very disappointing moment for us as activists, but thankfully National AIDS Trust went on to win that appeal, and that resulted in the rollout of the IMPACT trial, which was a 3-year implementation trial that eventually got to see about 25,000 of us in England obtain PrEP for free on the NHS through that trial. Now, having a trial was a little bit of a fudge. We wanted to see full rollout of a commissioned PrEP service, but I understand some of the reasoning behind waiting for using a trial as a way of waiting for the cost of PrEP to go down, making it much more affordable to the health service. But I think one of the things that really took me back to previous decades of being involved in HIV activism was I hadn't expected the backlash from the media and from some other quarters. And I can remember in the summer of 2016, after NAT, National AIDS Trust, originally won their court case, jumping into a black cab and being whisked through London to go to Broadcasting House and doing a whole afternoon of radio interviews about why this was a really important court case and why PrEP could be this kind of groundbreaking game changer around HIV prevention. And one of the broadcasters asked me if I thought that the ruling and the decision was around homophobia. And of course, the next morning we woke up to see the headlines in both the Daily Mail and the Times talking about gays winning a court case so that we could take a promiscuity pill at the expense of kids with cystic fibrosis. But that backfired. And why did that backfire? Because instead of NHS England's press department, who we now know had been in part responsible for pushing these narratives, what this meant is instead of pitching PrEP activists against cystic fibrosis activists, is that we came together, and I spent quite a lot of the next year working with a bunch of cystic fibrosis activists to work out how the parents of kids with cystic fibrosis could find workarounds the legal system so that they could start to import generic formulations of a drug, a cystic fibrosis drug from Argentina, at dozens of the times cheaper than the patented formulation that NHS England was saying that they couldn't afford. So in fact, it's brought PrEP activists and cystic fibrosis activists together to stand in solidarity, shoulder to shoulder, with those parents of kids with cystic fibrosis, being able to learn some activist lessons from us. And I think an emotional climax to that was actually sitting in a room in East London with a bunch of those parents, in a room where I felt that maybe I didn't have really much in common as a queer man without kids, sitting in a room with parents and grandparents and the representatives of the drug company in Argentina, bringing out some of the boxes of this cheap generic formulation of the cystic fibrosis drug with them. And one of the mothers sitting next to me and holding it in her hands and crying, because she said, this will keep my child or my grandchild alive for another year at tens of times cheaper than they could have afforded. And there were grandparents and parents in that room who had to remortgage their houses and sell their personal possessions in order to get this life-saving drug. And we all sat around this table and we wept because these parents and grandparents finally had this drug in their hands that could keep their kids alive. And so for us, it was a double win. We ended up winning the PrEP court case, but also we were able to translate all of this amazing learning over to people from a completely different health condition. And for me, that was a great big middle finger right up at the Daily Mail and the Times. Your hatred did not win. You did not win. It did completely the opposite. It made us stronger. It brought people together.
What is it like, Mary, to be working on AIDS issues, in HIV/AIDS issues? What brought you to this?
Well, I was diagnosed about almost 6 years ago. I guess I had a personal interest in it too. But I think that things that happened to me within that period, I was treated very badly. I had healthcare workers that would not touch me. I went to the women's community, they would not help me, right? And finally, my lover and I said, we're gonna go to ACT UP. And within ACT UP, there were a core set of men who said, look, we're gonna teach you everything we know, and hopefully you'll survive, and we want you to take it back out into the women's community. And that's exactly what I've done.
The US government did not take action during the AIDS crisis because it was primarily impacting the LGBTQ+ community. It was community activism that led to HIV research, to medication, and in turn to healthcare.
The purpose of this information is not for nostalgia. The real purpose is for movements of people today who are trying to make the changes that we all desperately need. And I think there's a few takeaways that are really important. So just to review, I think, you become the expert on your issue. You develop solutions that are reasonable, winnable, and doable. You present them clearly to the powers that be. When they refuse, you use nonviolent, theatrical, civil disobedience, or direct action to communicate to the public through the media that you have a solution that is reasonable, winnable, and doable. And this is how you put pressure on institutions. And this whole arc is what is called a campaign, so that every action that you do is based on a real demand that could actually happen, and that each action leads to another action. What you don't want to do is to waste the energy of your constituency by pulling people into one-time only demonstrations that don't have concrete demands, and you're not building a campaign. And you need an empowered constituency that is very informed. ACT UP people were very, very informed. We had no official spokespeople. Anybody could be a spokesperson. And there were teach-ins all the time, and people really knew what they were talking about. And they were never made to be passive, listening to speakers on a platform or something like that. It was always collective action and direct action.
I appreciate the use of anger, for instance, Mary, which I see you have in very healthy dose. Don't you think that's an aspect of your own mental health?
Anger?
Yeah.
Oh, there's nothing better than a really good demonstration. Definitely. I think that people who let anger manifest inside them, I think it's very, very dangerous. People say to me all the time, "Oh, you're a pretty angry woman." You're damn right I'm angry. I have every reason to be angry, and I think if every infected person in this country was angry, I think that a little bit more would be done.
And I look at the fact that I'm HIV positive today, and I wouldn't be alive today if I didn't get arrested 20 years ago. That's absolutely true. That if we didn't do what we did 20 years ago, I wouldn't be here. The medicines that I take to stay alive, I would not have.
The time when most people were planning their careers and their lives, we were burying our friends.
Here in San Francisco, ACT UP made history. In June 1990, the 6th International AIDS Conference was underway. Researchers, public policy experts, and journalists from around the world gathered to hear the latest scientific evidence on the deadly, rapidly spreading AIDS epidemic. ACT UP crashed the party.
Thousands of people showed up for the protests.
The days of quietly accepting government policy were over. The protesters turned their grief and anger into action. On the final day, hundreds of protesters stormed the stage. As the work of ACT UP in San Francisco and elsewhere helped everyone.
ACT UP changed the way medicine is practiced, the way research is done, the way drugs are approved.
Dr. Laura Esserman is director of the UCSF Breast Cancer Program. She has 2 trials underway, one for better screening, the other to get new treatments more quickly into the hands of women with early stage disease.
I think we need to start testing some of these medicines where they matter most, when we can still cure people.
She credits groups like ACT UP.
It is about urgency.
Many years later, it's still the case that activism drives research and healthcare for many in underrepresented communities. And I think it's fair to ask, how does this affect the relationship those communities have with research? How does it impact their trust of scientists?
I'm just wondering, do you feel science has changed? Do you think institutions have learned from ACT UP?
Well, a couple of things have not changed. When there is a health cataclysm, it's poor people and people of color who are most heavily impacted. And these fissures reveal the grotesque racial and economic inequalities in our country and globally. And that has not changed. Another thing that has not changed is that once the medication is discovered, the greed of pharma keeps it from being available. So here we're watching the development of vaccines and entire countries who can't get them because of the greed of pharma. And then this has not changed. And this is what happened with AIDS drugs. And here we are again. One of the things that I think the current pandemic has revealed, that AIDS also revealed, is that having national healthcare systems is not adequate. We need a global healthcare system where every person in the world has access to the standard of care. And it's not just because of my politics that I say that, it's practical, because borders have no relationship to pandemics. And that, I think, has become very, very clear.
I know from my own role as a scientist that a great deal of science communication seems to be about telling people what science has done. Thankfully, that's starting to change. There's so much to be gained from working with and learning from different communities with lived experiences. Perhaps if we focus less on what funders of scientists are looking for and more on how communities are impacted by our research, we'd serve the greater good and we'd deepen public trust in science. In the next episode, we'll be exploring the policing of mental health in It's OK to Ask for Help. The Trust Race is supported by PERITIA, an EU-funded project investigating public trust and expertise. Grant number 870883. This series is produced by Shaun and Maurice, and you can find me on Twitter at Shane D. Bergin.